Yes, madam.
Herman.
Yeah. Yeye amenipigia. Nataka kumtafuta. Sijampa. Anaona lakini naendelea kumtafuta. Nimemwandikia message. Ndia sia laptop ndiza la mwana.
Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong. Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong.
Doctors power!
Power!
Doctors power!
Power!
Doctors chalala!
Chalala!
Doctors chalala!
Chalala!
So how many people are speaking? Watu wangapi wanaongea? So two? Very good. Nataka kuemploy mtu mmoja atushikie microphone.
Asante sana, tunawakaribisha chai lunch basi wetu wenye walikuwa wameandikwa na ile program ya UHC. Tumeona serikali kuu imetangaza ya kwamba hizi contract zao zitakuwa renewed. Tumeona barua kutoka pale Ministry of Health. But what we want to say is that that was not the initial position for these healthcare workers, because UHC imeshika madaktari, imeshika nurses, imeshika clinical officers. Tunataka kusema ya kwamba ile vile tuliagana pale awali last year was that the terms and conditions of employment of these workers was to be permanent and pensionable, not the renewal of contracts that we have seen coming from Ministry of Health. It is a positive gesture, but it is not in good faith, because their honor has not been materialized. We need to see this UHC staff getting permanently employed, so that they can be staff of the county and actually provide the much needed healthcare services to the population. We want to say that the county governments, in our engagements with them, they have made known to us some of the financial challenges perhaps they go through, some of which we do not have the capacity to prove or disapprove, but such challenges have been like insufficient collection of funds generally, or delayed remittances by NHIF, or delayed disbursement from the national government. Those are not challenges in our capacity we are able to verify, but the effects of that have been that we see patients sometimes having to buy gloves by themselves. We see patients having to buy medicine by themselves, which we strongly commend, we strongly condemn. And we are saying that as a patient, when you come to seek services in a public hospital, not a private hospital, if you come to a government hospital, then it is the tax that you have already paid by other means, be it indirect tax, be it pay as you earn, be it all this manner of tax that as a population we are overburdened with. We believe that is what should be waiting for you at the hospitals, the government hospitals, and at the public schools. So when again the same people are subject to buying of gloves and subject to buying of own medicine to access the same healthcare, then it is utterly unfair. The challenges the county governments have mentioned to us are obvious, but we want to urge them that before they again overburden the already overwhelmed poor mama mboga, they must first of all make sure there's prudent use of whatever is available and whatever is within the access at this point in time, because we believe there's the amount that they collect or even before the increase. And also the UHC money, that has been the other issue. We have seen counties launching UHC previously and without funds, so that is actually fallacy. Healthcare is expensive. We all have to begin from that starting point. So what we want to urge the county governments is, even as they look for means of improving funding of this hospital so that the seamless supply of gloves and medicine and other consumables, they must ensure that whatever little that is there is prudently used, because that way the patients suffer and the healthcare workers cannot give the services. Where there are no gloves, a doctor cannot go to theater, a nurse cannot take your temperature, a clinic officer cannot see you in any manner when there are no gloves to even attend to a patient in the first place. So that would be our take. We want to add our voices to calling for the establishment of a Constitutional Health Services Commission. We have seen, kama tumeona pale mbeleni, wagonjwa wanateseka. Wakati mwingi sana unapata wale wafanyikazi wameenda strike. We have just mentioned here that if we are not promoted, if our patients are not supplied with enough drugs, then we shall down our tools. What we are saying is, we do not want these confusions in county governments to continue. We have seen that the counties have been with us for 10 years now. I believe, and we believe, that that is already enough opportunity, that is already enough time to test the counties. The counties have been tested, and it is our humble submission that they have failed terribly in healthcare delivery. So we want to support the establishment of a Constitutional Health Services Commission so that the provision of healthcare in Kitui County, in Mandera County, is the same as the provision of healthcare in Nairobi County and in Migori County and in Wajir County. We do not want to have inequalities in terms of healthcare provision, because that is what is envisioned in our Constitution of Kenya 2010, that every citizen has the right to affordable and highest attainable, underline highest attainable. When you have a county government that does not supply gloves, then for sure that must be the lowest attainable. The Constitution talks about highest attainable. So we want to say that we support a HSC, and we want to urge the national government to look into that issue so that together with the other constitutional commissions, the Judicial Service Commission, Teacher Service Commission, we want to have a Health Services Commission. We do not support, hatu support yule mwizi wa madawa. Ile tunasema ya kwamba investigations zinafaa zifanyike vizuri ili to establish kwamba actually yule mwenye aliiba dawa ni daktari ama si daktari. Kwa sababu wakati mwingi tunasikia kwamba inasemekana daktari ameiba dawa, daktari ameiba dawa. Unapata ya kwamba huyu daktari ndiye anasemanga hata hana ile dawa ya kuprescribe ya kuandikia mgonjwa. Sasa tena inakuwaje tena yeye ndiye ameiba ile dawa? Na tunasema hizi hospitali ziko na kamera kote. Ziko na CCTV katika kila room, so tunashindwa sisi pia ni aje kukiwa kuna wizi wa dawa tena hatuwezi jua ni nani ameiba zile dawa. Tunataka kuambia county governments wanafaa kufanya ile investigation. Ile tunataka kuambia wasithubutu kuenda kuvictimize ama kujaribu kuinterdict mfanyikazi mwenye hatujaona kesi yake ikikamilika. Kwa maana ya ile kusema waseme tu waamue wewe tumekutoa kazini ama wewe tumekufanyia hivi na hakuna ile evidence. Mtu hajapelekwa kotini, mtu hajapelekwa kwa polisi, inasemekana tu, na ilhali kuna kamera pale, tunajua inaweza onyesha hizi vitu zote. Tunataka kutoa onyo kali sana kwamba that is not what we expect. We do not support theft of medicines, because we believe that we are advocates for our patients. It is not possible that, again, it is the advocates who will again steal from the patient. It's us who treat those same patients. So we do not support it. Yeah. So it has been one of our resolutions from this AGM of today, the 3rd of June, that all doctors and healthcare workers are opposed to the housing tax, to the housing levy, because doctors feel, and other healthcare workers, that they're already tax burdened. We already have pay as you earn, and value-added tax, and indirect tax, and import duty, and so on and so forth. So an addition of housing tax is something that we vehemently oppose. We want to urge the national government to hold its horses and not overburden workers in general and doctors in specific with the housing tax. And this does not end just at the housing tax. We have seen the revised NHIF rates that have been proposed. Currently, as we speak, we have counties that are struggling with remittance of NHIF dues to the national NHIF. And even when they do, the services that we get from the NHIF are not what our members so far have considered adequate services. Actually, we have had members having to procure private insurance on several instances because they went to a hospital and their request for approval by the NHIF was declined because one county or the other did not remit the actual monies that was supposed to reach the NHIF, and yet it is deducted at the payslip. So we want to say housing levy, NHIF, we say no to NHIF. We say no to housing levy.
No to housing.
And we want to send a warning to the county governments that are in cohorts with the overburdening of the workers and doctors. Number one, because it is in this same county governments that we have lack of promotions. In Machakos County, for example, the healthcare workers and the doctors have not had promotion for the longest time. So Kitui County, again, we have had the governor commit to promote the doctors. And we want to encourage Governor, His Excellency Governor Malombe, to continue in that same spirit and promote all healthcare workers so that in the unlikely event that the housing levy is surcharged on these workers, then they do not collapse in the theaters, they do not collapse in the wards, neither do they collapse in the ICUs and clinics. So we want to urge all governors in Lower Eastern, the governor of Machakos, to emulate what the governor of Kitui is doing by committing to employ workers, committing to promote workers, and in such a time when we have shortages, the cost of living has gone high, the least you can do to your employee is to increase their wages by manner of promotion, which is their duly deserved right, and it is not a favor. And we want to urge all county governments, and it has also been a resolution of this meeting, that we shall be giving timelines to all these counties. We shall be communicating formally from the national office, and we will issue, if necessary, industrial disputes. We shall set stage to declare disputes with these county governments that have refused to encourage the morale of healthcare workers by promoting them.